My name's Julia Hakes, and I work for Oregon School-Based Health Alliance, and I'm the statewide Youth Advisory Council Coordinator. And at the statewide YAC, as we call ourselves, we're a group of 5 youth advocates. I'm the coordinator, so I'm not technically a youth, but I work with high school students who advocate for school-based health care. And at the Oregon School-Based Health Alliance, we advocate for school-based health care, and we provide support for school-based health centers. So a school-based health center is like a health center inside of your school. It's basically what it sounds like. Usually they have a nurse practitioner, and sometimes they have mental health care. And why school-based health centers are relevant to the Affordable Health Care Act and Cover Oregon is that a lot of them are doing enrollment, and school-based health centers accept health insurance, and that's how they get their funding a lot of the time. So yeah, recently with the statewide YAC, we went to the state capitol with a group of like 60 youth advocates and advocated for school-based health care. We spoke to, between the 60 youth, we spoke to around 15 legislators in Oregon who have school-based health centers in their districts. So it was a really great opportunity for youth to go in and feel empowered and speak directly with the legislators who are, deciding where the funding goes, and talk about why healthcare is important to them and share their stories. It's important because students don't have to miss school. That's the primary reason. I actually am from Oregon. I'm from Eugene, and my school had a school-based health center, and one time I thought I had strep throat, and so as opposed to, having to leave school, I didn't have a car always, so maybe my mom would have to come pick me up and then go to a clinic outside and get a prescription. I just went to my school-based health center, which was, 3 halls down, got a strep test, and got a prescription the same day. And so I didn't have to take my mom out of work, and I didn't actually really have to miss that much school because of it. Actually, I still had to miss school because I had strep. But still, and also school-based health centers provide physicals, immunizations. You hear all the time about students who have to miss school because they're not up to date on their immunizations, and I would have to get physicals depending on various programs I was going to participate in, and if I can just access that within my school, that's awesome.